What's up guys, welcome back to my channel. In this video I'm going to be talking about how to admit a patient into your facility, or basically what happens during an admission process. Why do people always say admissions always take so long? So as a licensed practical nurse, LPN, I was usually the person who just pops meds. Like, I never had to do anything, but in my travel nursing experience in El Paso, I actually had to do certain stuff that the RNs did in New York. So without further ado, here is what happens when a patient is admitted. Okay, so the first thing that happens when a patient is admitted is the hospital or facility or whatever, wherever the patient is coming from, would usually call you and say, can we give you a nurse's report? So a nurse's report is basically telling you everything you need to know about the patient that is coming, because you can't just accept everybody like that, right? So usually before that, administration handles, okay, yes, that patient is coming in, this patient has this insurance. That's administration. That's them. They're the one who deal with that. And once they've approved them to come into your facility at that specific day and time, then you take over and you're like, okay, we're gonna admit this patient into our facility. So the first thing you do is that you get your nurse's report. So the nurse from the hospital, wherever they come from, calls you and says, okay, patient Jaina is coming. Are you ready for your nurse's report? And then of course you'll say yes. So usually you would have like a sheet that you have that is pre-made by the facility, or you have a little piece of paper, however you guys do it, and you're gonna write down everything. What is in this nurse's report? Usually they talk about, okay, is the patient on O2? What was the patient's recent surgery? Does the patient have any follow-up appointments, which are very important? And usually, well, in my facility I was working, because it was like brand new, we had to make the appointments, or the morning shift had to make the appointments, or in some facilities the front desk, like the receptionist, make the appointments. So does the patient have any follow-up appointments with ortho or with I don't know, podiatry or whatever? Like, that is being taken care of. Okay, and then the second thing they do is in the nurse's report sheet, it talks about, is the patient on O2? What did the patient have? How are they ambulating to the bathroom, from the bed to the wheelchair, to chair to wheelchair? Is it 2-person assist, 1-person assist? What is their past history? Why did they come to the hospital? What is their most recent medical diagnosis, which is very important in the plan of care? What is their history of their diagnosis? Also, basically, like, any extra comments, any extra things. I'm probably omitting out a lot of stuff, but you guys get the gist of it. Like, basically everything, like, what is their diet? Are they chopped? Are they puree? Like, everything you have to know about the patient. And usually you have like a guide sheet that lets you know what questions to ask the nurse, when was their last bowel movement, the date, and everything like that. So once you get the report sheet, that's when you wait for the patient to come, and you could do your medicine or whatever you're doing. And usually, like, people are like, the administration, they usually have to enter them in the computer, but in our cases, sometimes we had to do it because it was so hectic. So you just put them in the computer, and we used PCC where we were at, which is point-click care. So before we put in the medications, we had to put in the drug allergy, and that's very important, because if you don't put the allergies first, it just messes up the whole medications. Just know that it's important to put the allergies of the patient. So of course you would get that in the nurse's report. So you write, the patient's allergies. But however, this is how you get the patient's allergies. You can get a nurse's report, but when the patient arrives from the hospital or whatever to your facility, make sure you mark down the time that they come, because you're going to put that in your admissions note. We'll get to that later. So patient comes via stretcher at 1300 o'clock. The supervisor should already tell you which room they should be in, or they should know already. So they say, okay, this patient goes to this room. Usually, in some facilities, the RN does the head-to-toe assessment before we even accept the patient. We do everything like that. We do our skin checks, whatever. And then the ambulance people, whatever, gives you a paper to sign. Say, hey, here's this patient. Here's what you need to sign for them. This patient is blah blah blah, and then you just sign for them, and everything is good. All right. So what do we first do? We ask our CNAs, hey, can you get weights? We need weights on the first day of admission, and in our facility where I was working before, it was every Tuesday. Every week on Tuesday, right? Once a week on Tuesday. Every facility will be different. Maybe it's once a week, maybe once a month. It depends on your facility. So the patient gets weighed. Patient obviously gets their vital signs. So we get a set of vital signs, a set of weights, and we make the patient feel comfortable. Maybe they have like a welcome delivery package with soap and everything. That's what we did in our facility where I went to travel nurse towards the end to make them feel comfortable, ask them how they are, and then that's it. And then they get in their bed, they feel comfortable, they relax, right? So while that situation is happening, if your facility is like really great, there will be a third nurse or a fourth nurse that will help come in. And we did have that in my facility that I worked in, come in and help put in the medications. So this part is very important. Usually they have, when the patient comes, they have a folder, and in that folder, it has like their follow-up appointments in there, like papers, their allergies, or their welcome packet from the hospital, different progress notes from the nurses, anything that's important. But they do have their last medication list, like their last review medication list, everything that the doctor ordered. So you put the medication in there. No, you don't. So the first thing you do is you find out which doctor is assigned to that patient, right, from your facility. So let's say your doctor is Dr. Fiji. Dr. Fiji, you call Dr. Fiji. Hi, Dr. Fiji, your patient Jaina came in today. Do you want me to go over the medication orders? And basically, that doctor has to approve all their previous medication orders that they were previously taking in the hospital before you could put it in the computer, because you can't just put it in the computer. Make sure the doctor approve it, and also ask the doctor, hey, do you want to order any labs for that patient, right? So when you call the doctor, it's always nice to say, hey, doctor, this is Dr. Jamie. She came from, I don't know, Whirlpool Hospital. Patient is an 83-year-old man, has history of CHF. Patient fell about 2 weeks ago in front of their house. Patient had a hip replacement surgery, blah, 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 blah. Patient's on oxygen. Patient's allergic to blah, blah, blah. Do you want to go over the medications? Like, just simple, like, just like a simple sentence, but just give the pertinent information. So you say all that, and then the doctor's like, oh, okay, well, okay, and you read out the medication. Usually they say, yeah, just continue. Usually they say, yeah, they'll continue, because usually admissions come around like 3 to 11. So usually they say, okay, yeah, just go ahead, and I approve everything. Most doctors do that, and then they come in the next day, and then they really look at the medication list and see if they want to continue everything. I usually find that in my case, that's what happens. But yeah, but that's basically what they do, and then they come in the next morning, and then they review the patient with you. So you add the medications in the computer. That's why it's really good if you have another person helping you, because even with PCC, point click care, the one I use, it takes time to put it in. It takes time to put the medication in. You have to make sure you have the right dose, the right patient. Because remember, you are setting precedent for all the future nurses, all the future shifts that are going to give medication to that nurse. And if it's wrong, they're going to look at you like, you know, that's going to be you. So that's going to be like you caused everybody to make a med error. So that's very important. Make sure you take your time when you're putting in that medication. And it can be hectic because you still have medications to give people, but you still have to like put in these orders. So you put in these orders, and doctor probably says, oh, let's order CBC B1P. I usually write that up real quick. There's usually a lab requisition book. You fill out the lab book, you just check CBC, PMP, or you just write in the bottom, you put the patient's name, their room number, and their labs, and then you put it for the next day, because usually the lab people come in the morning almost every time. So I just do it right away. That's probably one of the first things I do, because I know I'm going to forget. So I just put it 1, 2, 3, boom. Because if you forget the labs, people are going to look at you, I'm telling you. So that's what you do, and you put the medication in, Next thing you do their assessment. So usually the RN do it. If they don't do it, you have to do the assessment. You do a skin check. You ask the CNAs to help you. You do a skin check. You see if they have any abnormal skin tears, and this is very important because this is a way of letting people know, just in case people want to sue. Like, no, this patient came with this wound from the hospital, and they didn't get it from our facility. So you check the patient, make sure there's no skin tear, blah blah blah, make sure the patient's okay. Then you do that. You do a skin check thing. Then you do something called, well, in our facility we had IDT, and it's like such a long list of questions, like, what do you prefer to be named? What are you allergic to? What kind of food do you like? We do a patient education note. We do a more scale note, which I think is like on a scale of 1 to 10, like how likely is it that the patient will fall? So it's basically based off of like how like unsteady they are, how confused they are, stuff like that. We do a Braden scale. We do a lot of stuff. We do patient education, like, what level of education did the patient finish? We do all those steps. What else am I missing? Am I missing anything? We do IDT. IDT is like a comprehensive. We do all these assessments, and then all of them are basically part of their care plan. Then you print out the care plan and you have the patient sign out. This could be different depending on the facility you work, but I'm just giving you guys a basic point of view of like why admissions take so long. Because even when you're doing the IDT, it takes like about 45 minutes to get all those answers to those questions, especially if they don't speak English. You're gonna need a translator, or if you need to wait for their family to come so you could ask them because the patient's confused. So all that plays into factor, but all that is very important. Those are pertinent information, advanced directives, so that you have it in the patient's care plan. We know their DNR. All those things are in the patient's care plan. You print it out, you sign it, the patient signs it, you put it in their chart. That's another thing. You create a new chart for them, or the chart is created for you, and then all the papers that that they came with from the hospital, that folder that the folder that the ambulance gives you, the ambulance people give you, you go through it and then you put it in the chart. So you kind of like figure out where to put it. Like, so if it's a lab value, you put it under the labs. If it's a consent, you put it under consent. And in my old facility, we always got 2 consents, a pneumovac consent and influenza consent. If they consent to it, we put it. If the patient is on psychotropic medications, we also have a consent for that. You have to write the patient's name, room number, exactly which psychotropic medication. Even if it's melatonin, that's what we have. It's 5 milligrams, put it in there. Temazepam, whatever it is, every single medication, the patient has to consent and sign that they are taking a psychotropic medication. So you get all those consents, you get all the things from the patient, and then you give them their PPD. Their first PPD is due. Usually PPD is on admission. You write that PPD. You have to actually document inside the computer where there's an immunization tab, and you have to put the lot number, everything, and then to be read in 30 days. And some facilities have a step 2. So after you read the PPD, 7 days after, you have to make a step 2, and then you're done with it. So it all depends on your facility, but that is all that happens at admissions. And it's a lot, because sometimes the patient may be like, I need my meds, and sometimes you go to some place called the Omnicell, and they have that here in Texas, which I never saw in my life. But Omnicell is basically like a little machine where you get the medications. And oh yeah, very important, if the patient's on a certain narcotic that needs a triplicate, make sure you get the triplicate from the doctor. That's important. I mean, it's a lot of things when the patient first comes in, and you have to write down the dietary slip and give it to dietary, so make sure that tomorrow when they get their breakfast or their dinner or whatever, that they have the right kind of diet, like diabetic diet or renal diet or whatever it is. So all of that is very important. Chop, puree, like all that's very important. So all that has to be done on admissions, and like a whole host of things. So that is why, it's just, I'm sorry guys, I'm a little tired, but like, that is why admissions take so long, because it's just that long, guys. So yeah, so that's what happens in admissions. And sometimes the patient can be like very scared, so you have to be with them the whole night, especially working the night shift. You have to answer so many questions, and they're new to facilities, so of course they're scared. So that is basically what happens during admissions. I just wanted to give you guys a little heads up, a little overview. It may not be the exact same thing, because it's like a different facility, different strokes for different folks, but I just wanted to I wanted to give you guys an overview and make you understand like why people say admissions are so hectic. I never understood that, because I never really had to deal with admissions, but now that I just wanted to share with you guys that. Alright guys, so thank you guys so much for watching. Don't forget to give this video a thumbs up if you did find it helpful. Like, comment, and subscribe. Bye!